All right, this is chapter 40, caring for clients with neurologic deficits. For this chapter, we'll talk about what a neurologic deficit is, describe the 3 phases, aims of medical treatment, name 6 members of the healthcare team involved with the management of care, and then nursing management. So basically, like the book says, it's a condition where there is one or more functions of the central and peripheral nervous systems either decreased, impaired, or absent. So this could be like paralysis, muscle weakness, impaired speech, inability to recognize objects, difficulty walking or like just a unsteady gait, impaired memory, swallowing, and abnormal bowel and bladder elimination. So as you can see, this can be a lot, right? A lot of these are going to impair or just change kind of the way that patients are able to perform like ADLs and just their entire life, basically. Okay. Oops, that was the other one, sorry. Okay, so like I said, this is chapter 40. We already kind of defined it. So there are 3 phases: acute, recovery, and chronic. And all phases are not necessarily experienced by all clients, meaning they could have acute and recovery phase, but they're not going to have a chronic. They may have all, it just kind of really depends. All right, so the acute phase is going to be a sudden neurological event, like a stroke or something like that just happens with kind of it's more sudden onset. Sorry guys, my words. So basically we need to stabilize this patient and like stop what's going on or restore oxygenation to the brain, because remember, it's about 2 minutes that the brain can go without oxygen without severe neurological damage. So this can include drug therapy. They could be vented. They might have to go in and like clear the clot, whatever. So basically for the acute phase, what we're trying to do is stabilize that patient. So we want to make sure that we're frequently checking their neurological, or doing a neurological assessment. Has anything changed? Do they seem just the same amount of confused? Are they more confused? Are they not responsive now? That kind of stuff. Physical assessments, definitely get a GCS on them. And then, of course, we want to just prevent those complications from happening. A recovery phase, after the patient's obviously stabled, we kind of want to transition them into the recovery phase. So this can last weeks to months. Again, just kind of depending on how involved, I guess, that the injury itself was. So we want to still keep this patient stable and notice any other types of long-lasting neurological complications. We, again, want to kind of be continuously monitoring their abilities. Are they getting better? Of course, are we getting OT, PT, speech involved? That kind of stuff. So places like this would be like Loveless Rehab, or any kind of the rehab hospitals. Encompass is another one that we have. That's definitely where someone would be in the recovery phase. And then, unfortunately, we have our chronic phase. So client exhibits little to no improvement, and this progressively kind of worsens over time. So medical and surgical manage this, still prevent complications, and surgical rationale, correcting resulting problems. So if they, are having chronic issues, they may go in and surgically do something. But again, this phase is unfortunately a little less progressive. So this is kind of just how it is. They're stable, but they're not getting better. And there's potential, unfortunately, to get worse. So like I said, we want to prevent physical and psychological complications, and they may still go to a rehab center to try to retrain any skills. So basically the primary aims, like the book said, for this, these these neurological, conditions or illnesses is the management. So each phase is going to have a different goal, right, of management. So our acute phase, we definitely want to stabilize that patient. Our recovery phase, we want them to at least be stable and either prevent further complications or for further neurological impairment. And then moving on to chronic as well. Keep them stable, keep them from, worsening. Again, they may not be improving like in the recovery phase, but they're not worsening. As your book mentioned, here is all the team members that are responsible for, providing care. This is pretty common for most, right? So we have our nurse, CNAs or techs, we have our social worker, PT, OT, and speech. Those ones definitely are very, very important in this particular diagnosis. Dietitian, and our dietitian would probably be very important as well because, a lot of these neurological deficits have a lot of swallowing and chewing risks or aspiration risks. So we want to make sure that the, dietitian and the speech therapist are working together to make sure that we're giving this patient food that's appropriate for them, right? Psychotherapists, our pharmacists, make sure that they're getting the correct dosage of drugs and there it's appropriate. And then sometimes counselor, just again depending on kind of what they need at that stage. So these are a lot of, we talked about some of these in your simulations with our stroke patient, our younger stroke patient, right? So these were a lot of the concerns that, she had going back home, right? So fear, increased need for support, if they're unable to do the ADLs like they used to, definitely a caregiver burden, financial strain, home adaptation, and then just relearning of employment skills. Are they able to go back to work? If they're not, that financial strain is going to be even more of an issue. We have our medical management. This is kind of what we'll be doing the entire time, making sure we identify problems and needs, evaluation of a patient's abilities, assessments, definitely in these types of situations, coping, or how are they coping? Do they have the emotional support? Because this is like a long, life-changing journey. More socialization, making sure they're getting what they need. And then family. Again, we need to include family, making sure that they're accepting this life change. We also, sometimes a lot of family members, I'm sure you guys have experienced, I definitely have, and sometimes I unfortunately have experienced it as a family member. Like a little bit of denial at the beginning, like, no, this isn't that bad, it's not going to be so life-changing. A lot of us, that's our initial reaction, at least anyways. So we want to make sure that the family or the patient have realistic expectations of what their new baseline looks like. All right, that is it for this chapter.